Representative Banks.
Thank you, Mr. Chairman, and thank you to the DAV for being with us today. Appreciate all that you do and your leadership. Wondering, Commander Marshall, if you could talk for a moment about the main problems that you see regarding rural veterans and their ability to travel to receive care, and how can Congress better address some of those issues for our rural veterans?
Well, rural veterans' access to care, in those states, when you're not populated and you have to travel to the nearest VA system, which may be over 100 miles away, and now with the Mission Act, they can schedule you closer. But for further response, Ms. Elam?
For rural veterans, there's always been a problem in terms of access to health care. Just those communities, it's very hard to attract and have resources available there to meet all their health care needs. And I think the Office of Rural Health in VA, since that has been established, a number of pilots that have been very successful in coordinating care with the community. But I know, we know that a high percentage of veterans who use VA healthcare are living in rural communities. With the advent of really increasing telehealth, we do see some promising outlook, but we really need to make sure that that care is effective for them. And I know VA's very interested in that, given the pandemic for the past 2 years, and how that's really expanded care in rural communities. But there's still a lot of work to do. Technology will help, but there's still need for transportation to make sure we can get veterans to the care they need.
I appreciate that feedback. Commander Marshall, one last question for you. What do some of your members think about the Mission Act? And can you give us some advice on what Congress can do to improve on the program?
Well, thank you for the question. And as you know, the Mission Act, when it was implemented, had some very stern criteria. By definition, the actual acronym mission, maintaining internal systems and strengthening integrated outside networks. You know, sometimes when we look across the VA system as a whole, we see that the Department of Veterans Affairs wants to go one way or the other, and sometimes that's resource-driven. We have to do both. The internal systems is the key component. We have to have a strong backbone of the U.S. Department of Veterans Affairs for multiple missions. That's make sure that we educate those new clinicians that are, and we're talking about the entire healthcare provision in the United States. We also have to make sure we got a backup, a contingency for emergencies in the United States. We have to deliver the healthcare for our veterans, and we have to do so in a timely manner. And then we have to be, significantly considerate of all the resources. So we've got the AIR Act that's bearing down. So regardless of how long those processes take to stand up, we can't stop maintaining the internal U.S. Department of Veterans Affairs. So we've got to get the infrastructure fixed. We've got to make sure veterans have a place to go, get care in a prompt and timely manner at the high standards in which we expect to receive from the Department of Veterans Affairs.
Thank you again. I yield back.